Hello, everybody. Thank you for joining our webinar today. Data comes in all sizes. This is session 2. We had our last session on October 14th, and I apologize to any of you if you did try and join last week on the 21st, as we did not have that session. So just a few housekeeping items. If you do have any questions, comments, please feel free to use either the chat or Q&A function. And Sarah Leek is also on the call with me. My name is Alana Jarman, and we'll be beginning our session 2 today. We're going to be talking about feedback, data systems, and monitoring. These sessions are recorded and they are housed on our Mountain Pacific website. We will have another session next week on November 4th. So thank you for joining today, and we hope that you join again next week. So during our first session we held on October 14th, we reviewed the elements 1 and 2 for CMS QAPI principles. And for those of you who weren't able to join, that was recorded, like I just mentioned, and can be viewed at your convenience. And really, in most everything we do, the design or structure and leadership is really foundational. So we covered those 2 elements. And I think, you know, when I think of these, I think of me being a parent. When like, for instance, when my kids are talking with their friends, making plans, I expect them to first ask me permission to go somewhere, but then I'm asking with who, why, who is picking them up, and so on. So similar to how we work as a team within our organizations, we go about planning a project. In design and scope, we discuss the ongoing and comprehensive approach to ensure that our aim for safety and high quality care includes the systems of care and management practices. And with governance and leadership, and our governing body and/or leadership boards have that feedback and input from facility, staff, patients and their families and so on, so they can be sure to allocate the appropriate resources needed to conduct the QAPI efforts for your organization. So in any system, whether it's a nursing home, a hospital, a home health agency, really the goal to keep striving to improve your outcomes for the people you serve is in your mantra, correct? So as we mentioned in our previous slide, that we have a vetted plan to design and create the scope or objectives for your QAPI plan is imperative to ensuring that your outcomes align with what your internal organizational strategic goals are, as well as having the buy-in and support from your leadership, but also your staff are the foundations to making your QAPI goals a reality. So for this session, we're going to be discussing the feedback, data systems, and monitoring element. Within your organizations, you have systems in place to continuously monitor various things like temperature log for your medication fridge, like % of staff trained on equipment used within your organization. And so these types of things are to help track and identify gaps that may indicate needs for further investigations. Feedback systems incorporate the input from your patients, staff, stakeholders, and community members as a whole. So using QAPI to aid with this monitoring and process to review findings, or whether your internal processes or outcomes meet regional, state, or national benchmarks when it comes to performance. So using QAPI as a method to identify opportunities for improvement is important, but also help to mitigate or eliminate causes of harm or adverse outcomes, so we can focus our time and our precious resources on continuous improvement and not knee-jerk reactions. So I see a few. Perfect. So for some, the terms measure and metric are often used interchangeably, and some may call their metrics or measures their KPIs or key performance indicators. How understanding the difference in all of them is simply put like this. A metric is usually derived from one or more measures, and it can be a broad list of trackable areas, whereas a measure is a specific unit. And then a KPI, key performance indicator, is helping to narrow in on how effective and efficient you are meeting objectives set for your organization or coalition. So for today, I'm going to try to use more of the word metric because we have diverse participants on and from various settings. And you're more than welcome, type your name and your organization in the chat box too, just get to know each other. So in the CMS QAPI framework tool, they define the goals for feedback, data systems, and monitoring as 1, identify what you need to monitor. 2, collect, track, and monitor measures or indicators. 3, set goals, benchmarks, thresholds. 4, identifies gaps and opportunities. 5, prioritize what you will work to improve. And 6, use data to drive decisions. And I know all of that sounds like a lot to do, but it's pretty organic when you start working on it. So when we think about feedback and data, what do you do with it? How do you know what you are doing good or if you're doing bad? If you don't have a baseline comparison or a benchmark to strive to meet or exceed, it's kind of hard to know whether your team is doing well or not so well. How does your team currently decide on what to focus on? And if you have any input, please, by all means, put it in chat. And how about clinical care areas like pressure ulcers, infections, patient falls? How about medications that may need closer monitoring like antipsychotics or narcotics? Also, what kind of system is in place to collect feedback from residents, families, patients, caregivers? And what do you do when you receive that complaint? Or maybe it's a letter of appreciation. So it's easy to point fingers, but do you really think that's going to solve issues by pointing fingers? Most times it's a systems issue. And if you don't have the proper strategy to collect and use your data, then your efforts to mitigate or eliminate may not be useful or beneficial. Once you have the data, how do you act on it? What kind of targets do you have? And are they SMART goals? Remember, we spoke about those last week. And also, using a methodology and a structure helps your team stay on track and balance your metrics. When you think of a problem or issue you've identified through data collection, did you think of it in terms of high risk, high volume, problem-prone issue? Using these types of approaches helps to understand how to prioritize and what to focus your attention on first. So this looks like a very busy slide, but it's really, so what we think about when we need to monitor. For CMS, this is a list of healthcare organizations that must meet the conditions of participation or COPs and conditions for coverage, CFCs, to participate in the Medicare Medicaid programs, which is the single largest payer for healthcare in the United States. Nearly 90 million Americans rely on healthcare benefits through Medicare, Medicaid, and the State Children's Health Insurance Program, or SHIP. They ensure that the health and safety of people are adhered to, and that the organizations have a process for improving and protecting those beneficiaries. Some of those organizations are also recognized by accrediting organizations like the Joint Commission, DNV, AAHC, and so on. And they've also been approved by CMS to, quote, deem the organization as compliant with meeting or exceeding the CMS COPs or CFCs. I know there's a lot of acronyms, but therefore, as many of you serve on a community coalition, we also understand that you may have different regulations under CMS to abide by. But when it comes to QAPI, this is pretty universal, and the process really doesn't veer away from how to do it correctly. So to most of you, these names look very familiar. They are national benchmarks in which essentially healthcare organizations need to follow in order to comply with either participation or accreditation. Again, to go back, what we need to collect, track and monitor, and setting goals, benchmarks and thresholds, many of these listed will clearly have those stated. Within the CMS QAPI framework, they identify 12 action steps to QAPI. And so steps 1 through 6, we spoke about during our last session on October 14th. Step 1 is leadership responsibility and accountability. Step 2 is develop a deliberate approach to teamwork. Step 3 is take your QAPI pulse with a self-assessment. Step 4, Identify your organization's guiding principles. Step 5 is develop your QAPI plan. And then 6 was to conduct a QAPI awareness program. Step 7 and 8 relate to this QAPI principle for feedback, data systems, and monitoring. 7 is develop a strategy for collecting and using QAPI data. And 8 is identify your gaps and opportunities. So when we think about those 2 steps, how can these national metrics influence our focus, how we focus our priorities for data? To help understand the benchmark term, this refers to a standard against which other things can be measured or judged. And then a threshold is a measure of quality performance that must be achieved in order to be essentially in compliance with a standard or quality of care metric. So with many local, state, and national initiatives going on, we understand it is easy, very easy to become overwhelmed and feel defeated when it comes to QAPI planning. But using tools like a crosswalk, like I have shown here, it's visually easy to see where metrics intersect. So when your team can see the return on investment and how to prioritize how to work for your QAPI efforts, and it helps prepare for things such as a survey, or even just planning the objectives for your coalition, identifying what other metrics to consider for your work. So it helps reduce duplication of efforts, opening up our opportunities for more collaboration because there may be other programs that are also helping to meet these objectives. And this even gives you more return on investment than you originally thought, because you were able to meet multiple goals or metrics. It also helps to gain leverage with the work that you're currently doing. Again, by using a structured tool, such as this one from the CMS Quality Framework, helps when you are reviewing data from sources such as your minimum data set, your MDS, maybe your quality measure reports, feedback surveys from staff and patients. You can break down the metrics to understand if gaps or patterns exist and what opportunities you have for improvement. So as you can see in this tool, you identify what you are currently measuring, then go through how often you measure, where you get the data for that, who owns that measure. When you look at the aim or goal for that specific metric, think about how this relates to local, state, or national benchmarks. Then last, how is this reported out and to who? So now we're going to switch. I'm just going to go kind of briefly through these. There's quite a few different tools for QAPI, because next week, Sarah is going to be focusing really on a lot of the tools, but we'll cover a few of them today. So in the 4th goals for the CMS QAPI framework, identify gaps and opportunities. Using data and information helps determine gaps or patterns that could result in a quality problem. Using a gap analysis tool can be one of the ways you complete this activity. When we look at this tool, again, should be conducted with your QAPI team. It really shouldn't be done siloed work. But this tool will help identify missing strategies, structures, capabilities within your team and in your organization, processes, procedures, policies, skills, and so on, that your team may need to achieve your goals or metrics. So by knowing what you're currently measuring and what other local, state, or national benchmarks there are, what specific regulations your organization may need to meet helps to put this tool as more of a comprehensive approach. Also, when I see the words best practice, I think of that as a guidance. But if you look at it from an evidence-based point of view, you may find yourself striving for higher metrics and goals, but that is great, and that's what we want you to do. The root cause analysis is, for me, without a doubt, one of the fundamental tools for QAPI. It is used for identifying contributing causal factors that underlie variations in performance. It's also digging deeper and taking the time to interview and talk with your team. It's asking why until you get to the actual cause of the problem. And there's a tool actually called the 5 whys. And I'm sure it's pretty easy to figure out what you do. You ask why until you get to the problem. It may take more than 5 times. Historically, we have seen where organizations have received the complaint or issue and ready to point the finger and do the blame game. That is not what QAPI is about. That's why using tools like Just Culture to encourage an organizational culture change for accountability and identify systems level issues that cause harm. A root cause analysis is again an effort to identify the cause of the problem, not to find out who to blame. When your team does come together, the decision on what to focus on should be a structured, consistent process. Using the PDSA tool or model helps to put that structure and process onto paper. It's important to document your team's process and decision-making during this activity. Being able to test your process is the purpose of the PDSA. So you plan your change, then you carry out the test, then observe, analyze, and learn from the test. You study, and last, determine what modifications are needed to start the next step, act. Institute for Healthcare Improvement, or IHI, created a toolkit. Well, actually, they have a lot of really good vetted toolkits for QAPI on IHI on their website. IHI has the steps for conducting a PDSA like this. For the plan, we state the question you want to answer and make a prediction about what you think will happen. And that's where you develop a plan to test the change. And generally, it's recommended to start with small steps of change instead of trying to change an entire system. You ask the who, what, when, and where in planning. This is also where you identify what data you need to collect. Then you run the test on a small scale, carry the test out, all the while documenting problems and unexpected observations. That's key. This is where you'll start to collect and analyze the data. Then in study, your analyzed results will be compared to your predictions, and you complete this as a team if at all possible to analyze your data. Then under study, you summarize and reflect on what your team has learned. Last step, act. Based on what you learned from that test, make a plan for your next step. And you'll either adapt, make modifications and run another test, adopt, test the change on a larger scale, or abandon and don't do another test on this change idea. But you will for sure prepare a plan for the next PDSA, right? I hope so. So the Joint Commission, this is a tool from the Joint Commission. Obviously, they recently implemented a new process for their accredited facilities and even ones that are pursuing accreditation to use when identifying internal areas that need more priority based on the likelihood to harm and scope of spread. So this was adapted from another QAPI tool, but I like showing this one because it shows the colors, which red means higher priority for focus. If you use a tool like this to determine the likelihood to harm and the scope of spread, it helps identify more of a systems issue or a specific area that may need more attention. But even if it's a specific area, it still could be a systems issue. And then this just shows the definitions that the Joint Commission used to help facilities understand how to categorize these issues. So when you look at the low category, you see harm could happen, but would be rare. Then up to moderate, harm could easily happen occasionally. Then in high, we see harm could happen at any time. Then in the scope, the table for definitions, we see limited as unique occurrence that's not representative of a routine, regular practice. And in pattern, we see multiple occurrences of the deficiency or a single occurrence. And then widespread deficiency is pervasive in the facility or represents systemic failure. So when we look at how we're collecting and what we're doing for our data collection, using really structured tools like this helps us to really prioritize our focus. And then this is another tool similar to what I just showed you from the Joint Commission to help identify and conduct a systematic proactive analysis for how harm can occur. And with all these tools I've been showing, You really need to conduct as a team. And I think I've said that a few times, right? This allows the various expertise, different viewpoints, various workflows, and actual workflows. Not what your black and white documents say, but actual getting the input from the staff who conduct the work input. IHI states the FMEA tool, failure effect mode analysis. It helps prompts teams to review, evaluate, and record the following: steps in the process, failure modes, what could go wrong, failure causes, why would the failure happen, failure effects, what would the consequences of each failure be. They also go on to say teams use FMEA to evaluate processes for possible failures and to prevent them by correcting the processes proactively rather than reacting to adverse events after the failures have occurred. So this, as a preventative tool, helps you to catch those potential harms and mitigate or eliminate them versus responding to an actual harm. To this tool, when we think of where we would pull data to identify potential harms, is, for example, the safety reporting system your organization or your team uses to report things like medication errors, patient falls, but also near misses. When I've worked with organizations in the past, I stress that you want your team to increase the number of near misses reported because this gives you an opportunity to stop harm in its tracks. This tool was developed by CMS, helps to choose areas by prioritizing based on the needs of the residents and the organization. It takes into consideration the high risk, high volume, or problem prone areas that affect health outcomes and the quality of care. So how you use this tool is you first identify potential areas for improvement seen in the first column. Then, using the number rating above, choose 1 through 5 in each of the other columns. CMS does disclose that rating is subjective, and this, again, probably maybe heard me say this before, should be done as a team and is meant to guide and stimulate discussion. So then the areas, the higher scores, will be your areas of highest priority to begin your work as a QAPI team. Using standardized tools such as this and as a means to CMS says, stimulate discussion helps to give that voice of your team and may lead to discoveries that your team may not have been aware of. So I'm sure most of you are probably getting a little overloaded on all the QAPI tools I've just been showing, but get prepared because we're going to show you more next week. This tool helps identify data sources you can use for your performance improvement projects. You can see in the suggestions for the frequency is how often is that data source collected. Weekly, monthly, quarterly, annually. Then in benchmarks used when analyzing is it applicable to clinical guidelines or best practices? Is it a national data or organizational state data? Then putting that into accountability component in it, who will own that metric and analyze it for your team, and how often will they be doing that? Of course, it's important to keep your QAPI program accountable to stakeholders, governing body, community, and so on. So you will want to communicate this too. So you want to know how and how often. So according to AHRQ, I'm throwing a lot of acronyms at you today, but AHRQ, IHI, there's a lot of really good national, well-vetted organizations that have created a lot of standardized tools and templates. So again, I apologize for the acronyms, but anyway, AHRQ said to be able to assess and compare the quality of healthcare organizations, we use structure, process, and outcome measures. It's also known as the Donovan model, and it was actually named after a physician researcher who formulated it. Structural measures are to help understand the organizational capacity, systems, and processes. Process measures help to see what is being done to maintain or improve. And AHRQ states that the majority of healthcare quality measures used for public reporting are process measures. Then the outcome measures, this is a reflection of the healthcare services or interventions impact. These will help to show whether changes are leading to improvement. They also do not need to be complex. So some of the questions to ask for each are, for structure, how does the system impact the values of patients or their outcome? For process measures, are the parts or steps in the system performing as planned? Are we on task in our efforts to improve? And then in outcome measures, are changes designed to improve one part of the system causing new problems in other parts of the systems? So now I'm hoping that you guys are all ready to start typing because I'm going to start asking some questions. So get ready. So you can see the screen. What do you think are key considerations with any improvement project? What's important to your team for improvements? And what are some internal or external considerations do you need to plan with that project? For example, you want to eliminate waste, you want to optimize inventory, you want to manage time, you want to focus on a product or service. So in the chat box, and I just want to facilitate some discussion here, don't be shy, type in some of the things that in your work, what's important to your team for improvement, and what internal or external considerations do you need to consider for planning with that project? Resources, lack of time, maybe, you know, when you start thinking about what you need, where you want to go, and what are the challenges or barriers to do that work. Oh, there we go. Awesome. Our quality measures, we need to consider all aspects of clinical care. This starts with our assessments, staffing, and training. Great. Effect on the patient or resident. Yep. And a big key component that I think we've all kind of missed the mark on the last few years, maybe some of us have done a little bit better, is really getting that patient family engagement in our work. We are looking at follow-up and closure on RCA's root cause analysis within a timeline, as we do not get feedback from leadership. Yep. And so that's when you saw the first couple elements, design and scope and leadership and governance. I can definitely speak to that whole point of it really is important to get leadership on board at the get-go and understanding what is needed so that they can, like I said before, allocate resources to do your work as a QAPI team. So I think we're kind of at the top of the hour here, and I want to leave a little time for Sarah to talk about what we're going to talk about next week.
Hi, thank you, and thanks for joining today. But our next session is going to be November 4th, so I hope that you can join that one. And we are going to be looking at the explanations and definitions of elements 4 and 5. So those are performance improvement projects and systematic analysis and action. So we'll look at those, and also, as Alana mentioned, look at a lot of tools that are used in those areas. Hopefully some will be new to you, and I know that just looking at the chat that we had, that you're using RCA and obviously using some PIP. But that performance improvement projects are kind of looking at gathering the information and having a systematic approach to doing that, planning, implementing, measuring, and then clarifying issues or problems and interventions for improvements. And the focus on topics that are meaningful and address the needs of your residents or your staff or your patients. And then the need, as you also pointed out there, support of staff and leadership in being effective on these PIP teams. So again, we'll be looking at that, and we'll be looking at systematic analysis and action, which is modeling and promoting systems thinking, and taking action at the systems level to determine when in-depth analysis is needed. So I'm looking forward to you, and we'll have some homework for you next week. And then after next week, we're going to start diving into the data a couple weeks after that. Please, anything that you would like to see in the next session, we're happy to put that in there in the chat, and we'll certainly bring that up. All right, thank you, Alana.
Yes, thank you very much. And thank you all for joining today. Have a great rest of your day.